Medicine is changing. There are new breakthroughs all the time that change the ways that we diagnose, treat, and individualize care for patients. At Pinnacle, we're not going to rest on our laurels. We want to be front and center as medicine advances. Let me give you just a few quick examples of the kind of things that we're already thinking about. Point-of-care ultrasound is one of these, and it's really exciting. You may actually have already seen this because it's been pretty big in emergency medicine, critical care, and orthopedics. This is where the doctor uses an ultrasound machine, whether it's one that you wheel into the room or even handheld ones that fit in a lab coat pocket, to evaluate patients. Point-of-care ultrasound is highly accurate at diagnosing pneumonia or acute decompensated heart failure. You can diagnose and rule out gallbladder disease and DVTs, which are blood clots that form in deep veins, usually in the legs. Listen to this. It's as accurate as an MRI in diagnosing a complete rotator cuff tear. There are more and more uses for point-of-care ultrasound, and we want to be able to incorporate it when it applies to primary care. Some other things that we're looking into are shared specialist appointments. 1 out of every 3 patients in the United States are sent to see a specialist every year. If you've ever been one of these people, you may have felt that your specialist and your primary care doc weren't on the same page. And if so, you aren't alone. 70% of specialists rate the patient referral information that they receive from referring providers as subpar. And 63% of referring physicians are dissatisfied with the information that they get back from a specialist, and 25 to 50% don't even know whether their patients even see the specialist. It's a very prevalent breakdown in communication, and it can lead to unnecessary tests being ordered, delayed diagnoses, and longer medication lists. We want to make sure that this doesn't happen, so we're looking into ways that we, as your primary care doctors, can be there at least virtually for your specialist appointment. This way we can make certain that there's continuity of the specialist's care plan, and we can have a more effective relationship with our specialist colleagues. Another rapidly evolving area of medicine is in genetics. For example, genetic testing can give us some insight into your risk level for certain cancers or autoimmune conditions. And pharmacogenetics is a field that helps us determine whether certain medications could be an effective treatment for you, or which drugs would be more likely to cause side effects. Now, genetic medicine has been around for some time, but it's been growing quickly, and it's just another example of how we want to stay on the cutting edge of medical breakthroughs. There will never be a time where we become satisfied or complacent with what we can offer our patients. At Pinnacle, we view the ability to adapt and improve as not just important, but crucial. The next video is the last in our series. We'll be reviewing some of the highlights and talking about our priorities and our goals. We'll see you then.